Welcome back our fans to Dental History of TMG. 1. History. A. Chief complaint patient reasons for seeking treatment. B. History of present illness including accurate description of PTs. Symptoms type location duration. C. Medical history and review of systems. D. Dental history. History. 1. Chief. If the patient has more than one complaints, each complaint should be noted and placed in a list according to significance to the patient. Pain/headache. Joint sounds. Disturbed occlusion. Limited mouth opening. Medical history. 1. Systemic diseases. 2. Drugs. Dental history. Ask about bruxism or clenching. Recent dental therapies. Other habits. Nail biting. Excessive gum chewing. 2. Physical examination. Intraorally, the general condition of the teeth should be examined, occlusion and orthodontic treatment. Head and neck should be inspected for soft tissue asymmetry or evidence of muscular hypertrophy. Patients should be observed for signs of jaw clenching or other habits. Masticatory muscles should be systematically examined and trigger points while patient clenches his teeth. TMJ examination for tenderness and noise, the location of joint tenderness, e.g. lateral or posterior, should be noted by placing forefinger in external auditory meatus. 5. Many joint sounds clicking, crepitus can be easily heard without special instrumentation. 6. Auscultation with a stethoscope may allow less obvious sounds of joints such as mild crepitus. 7. Mandibular range of motion should be determined normal. Range of movement of adult mandibular is about 45 mm vertically and 10 mm protrusively and laterally. Physical examination. Inspection assessment of range of mandibular movements. Maximum mouth opening, lateral movement, deviation. Wide opening, protrusive movement. Assessment of mouth opening. 1. Max without pain. 2. Max with pain. 3. Assisted opening. 4. Pattern of opening. Lateral range of movement. Normal. Lateral range of movement is 7 mm. Measurements are made with teeth slightly separated, measuring the displacement of lower midline from maxillary midline. Any condition, muscle spasm, fracture, ankylosis displaced meniscus, that prevents the normal translation of one condyle will not prevent the contralateral condyle from sliding forward normally. The result is deviation of the chin toward the affected side. 3. Radiographic examination. A. Tomography. B. Arthrography. C. Computed tomography. D. MRI. Panoramic radiography. Advantages. Isn't considered a good imaging method for evaluating TMJ, since information about teeth and other parts of the jaws were also shown. Panoramic radiographs are helpful in evaluation condylar fractures. Disadvantages. The relationship between condyle and glenoid fossa cannot be evaluated in panoramic film because the fossa cannot be seen with superimposition of the base, the skull and zygomatic arch. All soft tissue including the disc can't be evaluated by this method. Tomography. Tomography creates a two-dimensional image of a three-dimensional structure. Objects in front and behind the selected plane of investigation are blurred. The dimensions of joint space. Arthrography. It is a technique for radiographic examination following injection of contrast medium into lower or upper joint spaces. It gives accuracy of diagnosing perforations and adhesions of the disc. 2. Redundancy of bilaminar zone. 3. Rupture of capsule. Computed tomography. It depends on the production of calculations of the object Density at discrete points across the axis of the object, either coronal, sagittal or axial. CT scanners produce digital data, measuring the extent of X-ray transmission through an object. This numerical information may be transformed into a density scale and used to reconstruct a visual image. It is applied in diagnosis of TMJ ankylosis, condyle fracture, osseous changes and disc displacement. Magnetic resonance imaging. MRI machine is designed with high and low strength magnetic field devices so that small tissue volumes within the body could be sampled for their unique resonant modulation patterns. Clinical MRI studies reflect the H+ density within a given tissue volume. This is different from the X-ray imaging, which depends on ionizing radiation and tissue absorption. MRI studies are obtained in sagittal and coronal cuts. Advantages: 1. Shows disc morphology, position and displacement. 2. Shows joint effusion. 3. Pathological conditions related to the joint. 4. Arthroscopy. Therapeutic and diagnostic technique useful in detecting adhesions, disc perforations and disc displacement. 5. Radionucleotide imaging, bone scanning. This technique provides an extremely sensitive method for evaluating degeneration and remodeling in TMJ. This technique provides injection Tc-99 radioactive isotope that is concentrated in areas of active bone metabolism. 3 hours after the injection, images are obtained using gamma camera. 6. Electromyography, EMG. It is a tool to monitor changes in muscle activity, so it a valuable tool in diagnosing myofascial pain dysfunction syndrome. Lab investigation. Rh factor, ESR, ANA, serum uric acid, GOUT. Thanks for watching. Support us by likes and subscribes.